just wipe it and we try to find out the kidney 3 point Tai Chi, where exactly the precise location. This is the tip of the medial malleolus. Try to find out the tip over here on the medial side, and then this tendon to be known as the Achilles tendon or the calcaneal tendon. The point is location is midway between the medial end of the Achilles tendon and then tip of the medial malleolus. Midway between this, the point is located here. So by the way, you just try to analyze. There is a pulse is there in this particular place, that's to be known as a posterior tibial artery. So that pulse is, you can palpate. If there is no pulse beat is there, then you can apply around this area. If you feel there is a palpation, then beside of that palpation area, we should be inserted towards the Kunlun. So just I am inserting the needle here, that to be towards the UB60 perpendicular direction. Now there is another direction to apply the same point towards the Ta Chung, that is the kidney 4 point. Where is the kidney 4 point is located? Now we try to find out. This is the Achilles tendon, inferior, half tune inferior to the K3, and then towards the medial end of the Achilles tendon, the point is kidney 4 here. So we wanted to activate the renal system. That time we just insert the needle kidney 3 towards the K4 also, advisable here. Now this is a tonification point for the renal system. At the same time, we wanted to use this as a perpendicular. Certainly we can use the UB60 region where that point is located here. So this is the tip of the lateral malleolus and then the Achilles tendon. Midway between these 2 points is Kunlun UB60. UB60 and then kidney 3. Together bilaterally we just activate in order to regulate the renal system and also the pelvic system, which the urinary bladder and uterus conditions as well. By the way, this is really useful for the low back issues, and also it is applicable for the regulating the GIT related disorders. I love and amazing this point, really. I love this because every day I have the opportunity to apply this point for the patients, right? Kidney 3 is the great powerful point. Now where this particular point is located, you look at about the this is the medial side. The small toe, pinky toe is the lateral side. The great toe is the medial side. Medial side there is a malleolus. That malleolus known as a medial malleolus bone. That is where the tibia bone, right? So now this is the medial malleolus is there. The location you try to see properly where exactly is located. Midway between the tip of the medial malleolus and then the medial border of the Achilles tendon. Achilles tendon also to be known as a calcaneal tendon, right? This tendon, so see, this tendon to be known as a Achilles tendon or Achilles tendon or the calcaneal tendon. So these muscles to be known as the gastrocnemius muscles. This gastrocnemius muscles is the motor point. This is the motor points. You just come down on the lower portion. These muscles will become what happen? It will become tendon. The muscles will become very strong. That strong muscles to be known as a strong connective tissues. So that to be known as a tendons. So this tendon, this is the external tendon. But I am talking about the medial side of the tendon. You touch and feel the tendon. You touch and feel there is the bunch of the muscles, bunch of the tendon. That is one tendon. That is from here, the tip of the medial malleolus. The tip of the medial malleolus, this is the Achilles tendon in the center. In the center, this to be known as a K3. This to be known as a kidney 3 point. Now K3 point is in fact kidney 3 point to be known as a grandmother point. Tonification point, that means tonification point to the kidneys. Right, this K3 point is applicable to the right kidney, and then K3 point on the left side applicable to the left side kidney. But however, according to the 5 elements theory, you wanted to use only the single point, that also applicable to the bilateral kidneys as well. That you feel that you are applying to the both the kidneys, you don't want to apply because it is works together, so therefore you just apply one particular point itself, that also quite enough. Make sure that point, when you are applying that point, try to feel there is a artery, there is a posterior tibial artery is there on that particular region, that you shouldn't damage while inserting the needle. When you insert the needle by mistakenly, that also get the vibration indicating that you have applied on the artery. At the same time, patient get screaming that they have the pain. When you insert the needle, the patient doesn't feel much pain, indicating you have applied in the proper needle. But when the patient is feeling that this peculiar pain, indicating you are applied in the wrong direction somewhere, and that is you are applying on the artery. Then when I took the pulses, 33 different types of the pulses, I think I took the demo for you, right, Natraj? So I have shown that the Tai Chi, K3, popliteal fossa, I have shown that particular place, and also different pulses, where the brachial pulse, where the temporalis pulse, where the popliteal pulse, where the tibialis anterior pulse, where the femoral pulse, where the obturator pulse. So many pulses I have shown you. Among them, this is the K3, one particular area I have shown you. Place the finger and then place, not giving pressure. If you give pressure, you can't see that pulses. But once you place, you can feel there is a palpating of that artery. The beside of that artery, next to that artery, medial to that artery, lateral to that artery, beside to that artery is recommended, because one acupuncture point is governing to the around 2 to 3 mm area it covers depending on the respective location. But in this area, around 2 mm acupuncture point is governing. But artery is taking care 1 mm, but you can apply around that, it covers the Tai Chi point. So therefore, now very superficially you just apply and then slightly go to the deeper level, but the needling to be done in the different directions. But I'll tell you 2 important directions. One direction is K3 is applied towards the Ta Chung, that is the K4. So K3 applied towards the Kunlun, that is the UB60 as well. You apply the, where is UB60? K3 on the medial side, UB60 last week has shown you, that is on the lateral side of the lateral malleolus. Lateral malleolus and then the Achilles tendon. Midway between that point is Kunlun, but the medial malleolus and then Achilles tendon. Midway between Tai Chi. But Tai Chi and then Kunlun applied together. One particular point is communicating to 2 acupuncture points. Apply K3. I'll show you how to apply in one needle in 2 acupuncture points. I just apply now. This is the demo. I use the needle, already use a needle. First you have to wipe very clearly. Exactly I applied. One, this is the K3, and you can find the needle is here. You can find the needle is here. So needle has come out, nearly half chun has came out. So that is indicating UB60. K3 plus UB60. You are having the dual effect. You are treating one particular needle. You are treating to the 4 internal organs. That is the key. right? Here K3 is communicating to the in link Chuan, that is the spleen 9, and then K3 is the equivalent portion, equivalent energy exchanging, because this is communicating. K3 is receiving the energy from the spleen. So spleen 9 is the grandson point, K3 is the grandmother point, communicating each other. So see, one thing is I am telling you, if sometimes you don't understand this, communicating equivalent sequences, and then K3 is equal to spleen 9, K2 is equal to H3P3, K1 is equal to liver 2, you don't understand as of now. You just ignore it. So who are the seniors and masters? They have studying for the last few years, and then you try to grasp and then communicate. When I'll teach you in the last classes, that particular time I'll give you the formulas, because now I'll give you formula, you don't take it, now again will be the confusion. Therefore you don't take it to your mind whenever you note down, because when you refer, even you can refer the Art of Classical Acupuncture, there I have given the equivalent sequences as well, because this is the key information. Once you understand this concept, then further treatment also super simple. That's the reason. Now if you don't understand, ignore it. But now I wanted to tell about one particular point. I wanted to tell you everything, whatever it is possible. Then you don't understand, you just don't feel bad. Okay, now I am treating to the 4 organs. That's keeping in the mind is not super simple. Now this one particular point you are treating to the 5 organs. I told you 4, I included 5 now. So one is the spleen and then kidney, the other one is the small intestine and urinary bladder, the other one is the triple warmer as well. You are communicating so powerful point. Then you think about Dr. Wu Wei Ping. Dr. Wu Wei Ping, he told, is the master in acupuncture. He said one acupuncture point can be treatable for 16,000 diseases. Then at least you believe one disease, since you are communicating to how many organs? 4 organs, 5 organs you are communicating in one particular needle. Then why can't you think about it? 10 diseases it goes, at least the one disease it goes, or the one particular disease, or not today, tomorrow certainly will be changes. So therefore this is the concept we all need to understand. But now Tai Chi, about the Tai Chi, what are the indications? But whatever I have given the 2 hours, the physiology of the traditional Chinese medicine, about the kidney meridian, all the physiological aspect, you can use the K3 point. What? Store the essence, and it regulates the bone marrow, growth and development, right, governing to the water, and also it is regulating to the skeletal system, right, it is opening to the ear system, and the scalp hairs to be regulated, and also gate of vitality. Everything you included this. Whatever I told you, you wanted to strengthen the kidney energy, keep it in your mind. 2 particular point always is good. I wanted to add up another point. 3 points to strengthen the kidney. Bilaterally you wanted to use, you can use it. The 1 point to be known as a Tai Chi, the other point to be known as a Fulio, the 3rd point is known as a Sao Hai. 3 points is the local, this is the distal point for the kidney. I think local points I told you on the back. There are the 4 points I told you on the back, and this is the distal point for the kidney. This also most powerful point to treat for the renal system. One is K3, K7, K6. When the person feeling the knee pain, when the patient is complaining about the back pain, when the patient is telling about the cervical pain, when the patient is telling about the ankle pain or the bone injury or anything connected to the bone related problem, impotency, premature ejaculation or strengthening to the renal system, regulating the water retention, regulating the gastric related problem, because when you understand this point is communicating to the spleen, when the spleen is having the more energy, when the spleen is occupying the excessive energy, a small amount of the food you take, that will get the bloating of the stomach is not transporting and transposition of the food is not taken place present precisely, that is the more retention of the food in the stomach region that descends the downwards direction, where the dampness get excessiveness, where the swelling have the more swelling on the lower extremities, or the abdominal swelling is there, or there is a heaviness is there in the body, anywhere in the heaviness in the body, especially on the lower extremities, also recommended to use. When the hair fall is there, alopecia is there, otitis media is there, otalgia is there, or there is some kind of the tinnitus is there, all these conditions can be recommended by activating this particular point. So powerful point is the kidney 3. So therefore spleen 9 and then K3 combined together certainly having the great effect. One particular point you are treating to the 2 organs now, right, according to the 5 elements theory. Then you connected that UB60, then urinary bladder and small intestine also connected here. You start practicing, that means slowly you try to apply the pressure on that particular region, or the seed apply, or the needle you just apply, half tune you just try on that particular region. That always is good. You can try to see the proper location has been highlighted.